Dr. Jean Marrazzo taking the podium right now. Let's go ahead and listen in.
Record-setting. Yesterday was the first day that we had over 1,000 cases reported in a single day. In fact, we had 1,014. And if you average the new cases per day over the last week or so, it's about 724 cases a day. So there is no question we're seeing more. Our total is now almost 26,000 cases that have been reported, and almost 770 people have lost their lives due to COVID-19. A couple of other points about this. We've tested about 300,000 people in the state, so that is a pretty small percentage. So clearly we are testing people who need to be tested. If you look at where these infections are occurring, they are increasingly widespread. So one thing that's changed from the early days of this epidemic is that most counties are now reporting cases on a daily basis. So the pandemic, the epidemic locally has really managed to perfuse into really every part of the state. We certainly have been seeing a concentration in urban areas, and we've seen that since day one. Part of that was almost certainly because that's where we were testing and where we had testing available from day one. But we're now very clearly seeing, given the reporting of cases in these counties and also looking at where the hospitalized cases are coming from, that they're being drawn very heavily from some of the more rural areas of the state. And that, as I have been emphasizing since day one, is a huge concern, given that the people who are in the rural areas have a much higher prevalence of some of the more alarming risk factors for mortality and bad outcomes related to COVID-19. So that's not a very good sign. People often ask about whether these increases in cases are just a function of increased diagnostic testing, and that is a great question. I think there are several ways that you can look at the data to try to figure that out. One of the things that we look at are the percent positive over the last 7 to 14 days. And if you look at our percent positive overall, on average, it's been about 8%. So about 8% of the tests that we have done in the state of Alabama have been positive. That you can compare to a place like Seattle, for example, where they're really on the downside of their epidemic. Their positive rate is down to about 1.5%, so an enviable place, which we are not at yet. If you look at the positivity, and that's a positivity, again, over a long period of time. If you look at the positivity in the last 14 days, it's about 8%. But if you move that up a little bit and just look at the last 7 days, the positivity is now close to 13%. So that's telling you that, yes, you may be testing more, but you're also detecting more. So it's a real, I think, a real increase in cases that we're finding. The other thing you want to look at, of course, are the hospitalizations that are occurring as a consequence of this disease. And unfortunately, as Savannah just noted, our census numbers are not coming down. In fact, people ask about a second wave here, and I've been saying we never stopped having a first wave. We have been really pretty much at steady state since this thing started. Our census at UAB has been essentially between 40 and 65, more commonly in the 50s, but as was noted today, we're now up again in the 60s. Other hospitals in the state, as I know you're aware, particularly in Montgomery, are really facing challenges providing intensive care for ventilated patients. Probably saw some press on that today. And the third part of that is that our healthcare workers are really getting stressed. I mean, it's a really intensive amount of work, as you have heard many times, to take care of these patients in the ICUs in particular. The other challenge we're facing, again on a medical update note, is that we now only have one emergently approved antiviral to treat this infection with. You may have seen today that the FDA removed its emergency authorization approval for hydroxychloroquine and azithromycin, given concerns about the lack of efficacy and also safety signals with those drugs. So now all we have is remdesivir, which we are studying in clinical trials, but is not really in good supply for the state. There's an emergency authorization use, but we don't have enough remdesivir to treat everybody who's in the hospital. So it's a really challenging situation, and I would just again emphasize that the timing of this is pretty perfect for when things started to open up at the end of May, right? We're on June 15th. That's exactly 15 days after the end of May and a little bit more after Memorial Day weekend. So if you do think that there is that relationship of 14 to 18 days, which is really what we've been saying is important to look at the trends. We really are probably in the thick of it. I think it's more related to people just stopping the really great attention they had paid to wearing masks and to social distancing, with a lot of not opportunities to go out in those early days. And people are now going out. Unfortunately, a lot of people are going out and forgetting that wearing a mask is an essential part of being able to re-enter society. So I would really plead with you, once again, if you're going to go out, please wear a mask. If you don't do it for yourself, do it for the healthcare workers who are really getting wiped out by the persistence of this process and the increasing numbers of people who are really, really sick, particularly in the Black Belt and in the Montgomery area. So remember, good hand hygiene, social distancing, physical distancing, and mask wearing. Those are really the key things to do.